by self, we talk to the counseling, the church member, the pastor, or some the friend, but we over the cross, the more deeply we have the peer mental health problem, the depression, the isolation, and alone. We had the treatment, the professional, the medical treatment. So we want more solution by self. You don't want to go to the hospital, right? Hospital or the psychologist or sometimes the mental specialist. So how can I solve depression or anxiety? So our boundary of my lifespan. So mental health condition often involve neurotransmitters imbalance or spiritual to brain different. So I will study MBT and CBT, also neuroscience, and I'm study the medical medicine in the Harvard Medical Study, the school. So we have somatic therapy and then mind medicine, and involve life coaching and psychology, social, mental training. So I want to give you some events or role life for you. This mental health condition depend on our evidence over the society or relationship in the community, and also we have to more touch face to face. The face to face means we have to open is my room, and then we meet the social activity, right? But no face means isolation. So we stay by alone in the room. So we protect, and you don't want to refuse any communication or relationship with other people. So face to face means we have basically a solution to depression or anxiety. So we can live by ourselves. We need some other people together, along more friendly or more the good relationship in the community, right? So include the church member or workplace or social the issue. The risk, someone might use medication or therapy as a shortcut. The shortcut means it's not whole life, just a short time and with medication. Because of mental disorder have a lot of medication. My patient have a 13 kind of medication every day. So it's a long time, 1 year to 2 years, 3 years. They have more medication work the body, but emotionally or mentally is more the deeply or during the time. So we have to using the shortcut, the medication therapy, or a sign of the spiritual weakness. The result, the delaying evidence-based treatment, like a CIS or CBT, can allow the condition to worsen and sometimes leading a point of crisis or self-harm that could have been prevented. So the crisis or self-harm that could have been prevented. So CBT, the series, the treatment is very good. They're useful, the basic over depression or anxiety. 3. Regulars over scrupulosity and OCD. What is the OCD? Yes.
이거 거기 전 페이지에요.
네.
Sign of spiritual weakness가 우리말로 뭐 어떻게 표현되는 거예요? 우리 거기 그러니까
영적으로 약함, 영적 약함을 얘기해 주는 거예요.
그냥 영적 약함으로 되는 거예요?
이따 말씀드릴게요.
네.
이 녹음하니까.
죄송해요. 죄송해요.
The delay or avoidance of medical treatment. So we have a risk and results. The trace reverses scrupulosity in the OCD. The fourth dust in the OCD, the spiritually the condition is particularly so dangerous. Why is dangerous? I give the answer to you. This is often called the scrupulosity and some type or OCDs involving the pedagogical the guilt or obsession in or moral or religious issue. So sometimes we have screen time in the church too, and broken the communication and the relationship. So we want more open mind and we want more Christ and we love the Jesus, the church. So we going to the church every Sunday church. But sometimes we have some here, the guilt or somebody the break heart. So the Jesus love everybody and the Christian love everybody. So we are the kingdom of the daughter or son, but sometimes we broke this relationship because argue or pace. So it's not unhappy the evidence, right? So we have the regulatory issue. The risk, if on a series suffers is told that their intrusive thoughts, the demonic, the simple is a very of vision. The results, the individuals may perform endless or rigorous rituals, the competition to find relief, which on the reinforce the OCD cycle and make disorder more intensive. You understand this one? You're a Christian, right?
Yeah.
So sometimes we have a second son. Not every time happy. The church, right?
So the approach is there is a the approach is there is a conflict, or because we have to consider the medical science approach and the spiritual aspect of every individual.
Yes.
Yeah.
So last time we I touched compare the coaching, the personal coaching and counseling, and then medical the treatment, and then medical psychologists they have the guideline, and then you do the medication. So this part we start 1 week, the 2 week with medically with personal issue, and then we can try to solve more personal coaching or life coaching. But today we start more medical treatment. So sometimes we start cover some of the mental or counseling, right? We need some especially we had to more approach to more the medical the treatment and then spiritual the counseling to put together is more synergy.
But sometimes in my experience, sir, because I'm also a religious counselor in our church, sometimes I mean like younger ones. So if the case is about mental disorder, so it is really hard. It is harder to give them a spiritual approach.
Yes.
But medical approach is easier because the treatment is already there. I mean like medication or isolation, or it depends upon their needs. Whereas in spiritual, we have to prepare the concerned person or the patient for the spiritual approach, because sometimes they misunderstand it as like just a simple advice, where in fact it is already we are already bringing them into a spiritual approach already.
Yes.
Yeah.
So personal coaching is a more approachable side. So we assistant. So the personal, the problem, the client or the church member, we only support, and then the coaching mean just we have problem, but the by itself is more the approach. We know that, right? So we need the assistant. So coaching is more spiritually, spiritually, and then more emotionally, moral, the spiritual issue, and then more coaching, comfortable. But the medical part, medical treatment, there's some evidence over manual. So maybe we haven't worked 1 year, 5 years, 10 years. So this kind of person, maybe this type, big person, maybe this type. So only we follow the manual. But sometimes the manually is good organizer, and we have evidence of results, so we can try to some. But sometimes very work, but it's a shortcut, like a long time now, because we are hospital, mental hospital, very more increased now, all area, all the state of America. So why? They have more, try to more medical issue and medication.
Yeah.
Yeah, if the possibility, we want more cure and the mental disorder, the surgery, but it's okay. But why we manually the medical treatment we cover all and personal life or some people with a mental disorder, it's not cured. They stay long time. Long time they stay the hospital, the management, right? So we're shortcut. It's not covered with medication. Because the personal coaching is we try to approach more the personal life, the soluble solution together. Well, medical treatment, they focus 100% manual. For same medicine, A or Z type, but the same thing, not too much. They have 5 kinds of medication, they cover all the patient over issue? No, I don't think so. So sometimes we have to try the personal coaching, the step by step, the work together, work together. So we attach to the names, this Christian spiritual warfare and the counseling is a more side of the personal coaching. Okay. The Lewis School of Policy OCD. Hi Joy.
What is
You
it?
come early today. Hi, Mister.
Edwin.
Yeah, really? Okay, good. The for those series, the page 52, OCD, the spiritually the condition were particularly dangerous. This is often called the school policy, the subtype of OCD involving the pedagogical, the guilt, omission, or moral liberty issue. The risk, if only OCD sufferer is told that the incidents were taught, the demonic or sinful is valueless or omission. The leaders, the individual may perform endless regressive ritual. The conclusion, to find the relief, which on the reinforce OCD cycle and make disorder more interesting. And the spiritual, the bypassing.
Sir, can
Yeah.
we study also about the symptoms of these different mental disorders like OCD?
Yes,
Maybe
OCD.
because we cannot recognize if it is still normal, the individual, or no longer normal, because maybe we just charge this as an attitude, negative attitude, but in fact it is already a symptom of OCD.
So we give it a more the right in the second page. So you should usually OCD, right? So OCD and we have the counseling and the medication. So we compare. We have maybe 54. They have a more compare.
Okay.
Okay, spiritual bypassing. Mister, what is the spiritual bypassing? You think about what is bypassing?
Sir?
Yeah, this
Spiritual
one.
bypassing.
Yeah, spiritual bypassing. What's mean?
Sa'yo mo yan.
You don't. I give it less.
Kagamay mo. Asan sa...
Tumayo ka kasi lumapit ka doon.
Come here. Come right here.
Processing?
Yeah.
Bypassing.
Bypassing.
Before.
What is the
Oh,
bypassing?
spiritual bypassing.
Yeah. What is that?
So nila natin
It is the tendency to use spiritual. You know?
No. Only your things. Your opinion.
On your words.
Yeah. What is the bypassing in your work?
Avoid facing conflicts. It's like if you are, when I as what I have understood about bypassing, if you have heart bypass, so it's like
Okay.
in order for you to sustain, or you need to look for another way
Okay.
to take care of your spiritual life, maybe.
Okay. Today, my class is a medical doctor study class, right? No spiritual counseling class. Okay. Bypassing. We stay.
Avoid.
Avoid, and we don't want to stop. We don't good supplication, right? So,
Okay. Bypass.
Sometimes we have a certain time is my spirit, the situation. So we had to more growing, or we had to front, but sometimes we have traffic. It's like we have bumper to bumper, right? The traffic. So it's my spiritual power or my condition, the state. So we had some certain issue in my front, unexpected issue, right? So we had to clear, and also we had to more elevate my problem and then keep going. The smooth ride, right? So bypassing, he told me, maybe sometimes heart attack or sometimes we have a more the problem issue, and then we have surgery or bypassing and something. We are the spirit bypassing. We have isolation or certain it's my spiritual problem, so we had to remove or eliminate some issue. We going more the personal growing. So the spiritual bypassing is the tendency to use spiritual explanation to avoid passing complex psychological burden or trauma. So trauma, we have two trauma, right? The child trauma, the past time, and now the second trauma, present or the tomorrow, but not yet the tomorrow, the present today. So we have an aspect of trauma continue today. So you had more clear, you can clear why this is a long time ago have the experience. So, but you can try to more the spiritually explanation of the passing complex and the psychological wounds or trauma. So we can try to reset up brain. Okay, this I have a bad trauma experience, but now I'm more growing up, and then I'm older person. But before long time ago, the child trauma, maybe 6 or 10, right? So we can control or think about. So now I can control same situation. So we have to reset up the brain. So we have to study the CBT, the OCD, they continue work because we have to reset up. Okay, this kind of trauma now I have a better experience, and I have a trauma I wouldn't, but now I can control. So we had to okay. Now so I'm okay. So we had to more change it. We are more good memory. Okay, I have experience. So last time I had to do avoidment evidence or issue work, I had to prevent some unexpected situation. So this one, the list, the using preachers like the just help peace, the giving in the universe afterward band aid or the deep wooden bandage. Sometimes we have a wooden or scratch, right? The skin scratch with the bandage, right? So we have the temporary. Why? We don't want the bacteria or the infection and the out of our air, right? So we had airborne. So we had a temporary bandage. Why? We want prevent infection. So sometimes we need the bandages. We are situation, unexpected situation. Sometimes the panic or sometimes the trauma, the future. So we had some word, the past post trauma, the child trauma, and then now we have a second trauma. So everything is complex. So we had sometimes we had to more the solution over bandage over by self. Okay. The results, it prevents the person from doing the missionaries often the difficult, the shadow work, or therapeutic processing required over long-term healing. So long-term healing, the typical shadow work or therapeutic processing the required for long-term healing. So without the medication, the body medication have a shortcut. Why? Too much side effect. So maybe sometimes control the insomnia or some depression or mental disorder, but you can use it in the long term. Okay, the long term healing, I mean without the medication, we had the coaching or we had going together. We have make management or this mental disorder. Okay, here. The speaking bypassing here, and then long-term healing here, processing declarable therapeutic. So why it prevents the person from doing the rationally often difficult shared work. The revealing is a universal human pursuit, painting many different cultural elements, the moral concept and the ideas, and influencing the human thinking and the behavior by offering answer or meaning of human experience. So human experience equals experience too. The language provide comprehensive the sympathetic inside our human orientation in the world, and it's an important element of human culture. So sympathetic inside our human orientation and in the world, and important element of our human culture. The practice of dealings with the spirits share the thought, literal or non-literal thought, and interpretation of our evidence and the special experience, the concordance, the social norm, and the context is a artistic or artist expression and the symbol, as well as many other like domain or comparatively enable in the individual and the complex system. So individual and the complex system. So trauma, you have a child trauma, and then the second trauma, they make it complex. So we had to solve some of the mental disorder. They include anxiety or depression. So we had to find out root over this mental disorder. So this is not simple. So individual, but we had to compress some trauma. So we had to more life domain, the complex embedded this individual and the complex system. On the other hand, linguist word terms reflects various of aspects of our linguist belief. The last time we studied the personal belief, the belief, the spirituality weakness, and activity or personal life. In the literatures, ethnicity, linguistic or commonly distinguished from the Hispanic linguistic. Intellistic, linguistic or implicit were integration of regulation, teaching, and the kind of our personal master, the motive in regulation. And has the initiative linguistic reflect more instrumental and then utilitarian aspect of our regulation. The providing secretary or thought, the solidity of administration, the states, and the self-justification. So we have more this kind of study here. So individually, and we have company system. So we had to realize kind of negation view. We have a mental disorder. It's not easy, but we can solve it by self too. So I want to question here. The spirituality was suggested to be transcultural and trans-revolution parameter or human experience constituting the complex, ideographic, and multi-dimensional construct, not closely associated to particular belief system, the church or culture. So how about your opinion? We learned this one, right? The personally, individually, or the complex, the system. So we have to apply to the church environment. So how about you think? This belief system and or church. The spiritually some issue or pair. So we textbook name is we Christian. The spiritual warfare, right? So warfare, and we make a complex the trauma and the mental disorder. There are some people, some church members have some the mental disorder in the church. So do you have a did you have a more experience? You
This paranormal belief,
yeah.
I think it is related to miracle.
Mhm.
Yeah, God's miracle in healing individual. So that's one thing that we can refer to the Bible also about, asking healing from God, and that we can insinuate always to that individual who is suffering from any mental disorder.
Okay.
So paranormal, as I can understand, is beyond the physical expectation. So it's like, as I said, is a miracle healing.
Okay.
So that's what I understood for this topic, sir.
Yeah, but sometimes the church, the system then control them, right? Is a normal or some sickness or mental disorder people, right? Mr. How about your opinion?
It's, I think this one paranormal beliefs is like those who are in the traditional rituals in the religions, especially as in the Philippines, is mostly are Catholic. We have many beliefs, superstitious beliefs that are not according to the scriptures, but because of our religion, we believe like this, we believe like that. We believe that there is spirits in the old tree. Something like that, maybe about the paranormal.
Okay. How about you? How about your opinion?
Ghost.
The same?
Ghost.
Well,
Ghost.
okay. Okay.
There's a ghost.
Okay. So now the very important part, the personal belief. So we are our lifespan. So what kind of more galong is church the culture. So paranormal and then medical addition. So what kind of story here we think about it here? Apart from RS, the paranormal and medical addition also attributed the personal individual belief system. Paranormal belief relates to paranormal that relates to basic limiting the principle in the science, the terms, the medical addition, the report belief about causality in his individual belief they have some degree over control over event that defy or currently affect physical law. Yeah, physical law affect. Yeah, many study the support the scientific positive. The many study the evidence the positive but complex correlation between degrees or paranormal belief variable where either degrees or score have been associated with a stronger paranormal belief. Yet, the RS, degrees of practice and personal belief not only the importance for culture and the social life, the important for culture and the social life, but this one the personal life, right? The personal belief, we see individual physical and the mental health and the important for culture and the social life. But they have also the interplay or scientific role in the respect for individual physical and the mental health. So personal belief and the culture and the social life and individual physical and the mental health. So we complex together. The University of Spiritually Physical Health and Well-being. The many studies indicate that RS and English practice may have a present and a scientific positive influence on general physical health, life satisfaction, and subjective well-being. So we have a positive influence on generally the physical health. So mental health, the spiritual health, the emotional health, the mood health, and our inner health, everything the collective, and then life satisfaction. So sometimes I'm happy, I like it, no problems my span today. But some people have depression or isolation or second time. So usually positive things or positive mental, the situation or condition on general dependent or physical health, life certification, and subjective well-being. This positive impact or as human well-being become more observable among people under the stressful circumstances and the physical illness. So human well-being become more obvious among people under the stressful circumstances and the physical illness, and sometimes illness, my situation, and then community. So sometimes family issue or my personal life, my workplace or the church. So they have more, obviously more people under stressful. So how about you? How about your lifespan? You are stressful, your circumstances, or you have a community or your family, okay?
In the present time,
Yes,
yeah, I am very alright.
okay, good. How about you? Your lifespan is a celebration, or some you a little more avoid the stress for the sacrament? You're happy?
Happy, yeah.
Happy? How about you?
Of course.
Okay, how about Minister? Okay. Joy, you're not today purpose anything. You should have you're unhappy, right? You happy?
Yes.
Yeah. How about you? The other person, what's your name?
Oh, Taisei.
Taisei. How about your lifespan? Is it happy, unhappy? You have a certain time or you have positive things?
Yeah.
Your physical issue or emotional issue?
Yeah, it's happy.
You're happy?
Yeah.
Okay. You're now the little sleeping.
Yeah.
Okay. Maybe I know you meet with God, right?
Meditate.
Yeah. Okay, terminals illness or cardiovascular disease or cancer, the pain and immune and the endocrine disease on some especially or which the influence over rigorous carving has been put forth in the literature. So sometimes we have a medical issue, so we need some of the help and the medical treatment with the medication, the outside, right? But sometimes we have a sickness, the situation, we have inside the church. So sometimes we have the pastor or the minister give the healing or the prayer for some people, the spiritually they're more comfortable and then they're more message healing. So I have a lot of experience. Because it's my job, I'm a practitioner, right? So some people I touch my hand, but spiritually touch the pray for somebody. So some story, the pastor pray for the sickness people, they more the recovery, the busy. But we had to more think about that. We together the hospital service, okay? Not depend on 100% of our church, okay? So we need our body, the spiritually the disorder we can do, but the physical issue and then medical issue, so we have to be the medical team. But for some individuals, real estate may enhance the ability to overcome negative life events, unexpected situation or the panic or some unexpected trauma. Whereas for others, negative life events may result in a great release of faith. The university or spirituality or mental health. I used to work the psychology or physical therapist and the counselor, and then I'm studying the mind medicine in the Harvard Medical School. They give to me good tips. The life coaching means it's not only the spiritual disorder, mental disorder. No, we have nutritional or physical movement, and then we have the relation of our community or the personal issue and the hygiene. So we have to compare. We will integrate everything. So only part individual, only part of the community. No, you together the bridge. So we integrate our solution. So for the last 3 decades, the relationship between RLS, the individually, and then we have community or the union, and the mental has been extensively studied, indicating what scientific education among the variable. RLS has been found to investigate collected the prevalence of any mental disorder, too much depression, too much anxiety. In the particular, to have a positive impact or depression, suicidal thought and the behavior, and the alcohol dependence. Now we start now addiction. So we alcoholism, and then we also drug and something addiction. But even we had a game, the computer. Now teenager they addiction of game, digital addiction. So mental disorder in the particular to have positive impact over depression, suicidal thoughts and behavior, and alcohol dependence or drug abuse. The future more, it is suggests that RS not only are a protective factor over mental health, but that is also might positively influence our treatment outcome or some mental disorder. However, research has also point out many contrary or results. For example, higher interest orientation has been found to be associated or reduced risk of depression. And it also have been collected higher risk for most physical or disorder, general and for depression specialty. So 1 month ago, I visited Washington State. I visited the church. The young man, he had some mental disorder and also depression, and then so many times they isolated at home. They never work, and they have a medication, maybe 5 kinds of medication. So anti-hygiene or insomnia, and about high cholesterol, and then diabetes, and then overweight. And so she have a depression, and then she tried to survive time the suicide. But now he's more recovery the situation. So he want the face to face. He want to try go Sunday church. So now little change emotion, and then more they will much better. And then I give it to the medication. They start. So first time he refused anything. Sorry, his mom called me. Yeah, please help me, my son. But the son refused. He don't want to go to church. But someday he wanted more to meet me. So first time we talking, and then I listened to his side. He give to 100% open mind or not, I don't know. But at least maybe 70% open mind to me. So several times we call contact. So I listened to his story, the post trauma, the friend what kind of supplement or the personal life, and what kind of the diet, what kind of medication, what kind of hobby, what's problem. So we 3 hours recording. So okay, so I give her nothing good tip, just listening. But he want to try to open mind, because everybody, the church people, okay, yeah, maybe his name is John, for example. Oh, John, okay, are you okay? Oh, you have to lose weight. So are you okay? Please come in Sunday. That's it. So nobody wants to listen to his story. Why I'm screen time? Why when started my problem? When start just only say to hi, and then nobody listen to his story, the hard time. So anybody want to try approach the solution or the healing the people. So if you find out someone in the church, maybe second time or mental disorder, just say the friendly, more hurt, and then you want to try to more listen from them. It's more they open mind, they change. Okay, only the say hi, say to hi. Oh, okay, this kind the person. Okay, I don't care. Oh, I don't want to bother him. Yeah, so he mess the church. Some lady is a mess the church. Oh, I don't want. Yeah, so please, you're more try to more listen to them. That they open mind, they change personal life when they change your evidence or the church life. Okay. The rollover lyrics covering the personal beliefs show the multi-dimensional, whereas the several RS aspects seem to have different, not only the positive impact, not always, but positive impact, mean always the negative impact of mental health. Occasionally, scholars report that different RS aspects show different relationship to particular externalizing the mental disorder, substance or dependence or antisocial behavior, the substance or dependent. So isolation or face-to-face, and interrelated the mental disorder, major depression, the generalized or anxiety disorder, the phobia, the panic disorder, and bulimia nervosa. So and also add one more, hot temper. Sometimes we have more try to talk to your subside. So suggesting that different aspects of RS can have both positive and negative influence on the individual. So we have the positive section or negative some, and influence on the individual, the personal belief and the personal life. So we have more here. The Kindle, the report, different aspects show different relations to particular externalizing the mental disorder. But this mental disorder, and we have to suggest that different aspects or can have both positive side or negative side, and where the influence on the individual. Okay. Try getting lately, yeah, lately try.
Lately, research has suggested that with respect to mental health, the greatest importance seems not to lie on religious or spiritual beliefs in general, but rather than specific religious coping strategies. Religious coping reflects the functional expressions of religious or spiritual in stressful situations. Positive religious coping is suggested to have a positive impact on mental health. In particular, higher worship frequency, general religious involvement, and prayer and scripture reading have been shown to exert an overall positive effect and to be associated with better mental health. These effects could not be explained by positive meditative components of religious activity. On the other hand, negative religious coping, for example, wondering whether God has abandoned someone or believing in a punishing, vengeful, or simply indifferent
Okay.
God.
Okay. Yeah, more. Oh, it was less than frequent.
Although less frequent than positive religious coping, has been repeatedly found in close association to negative psychological adjustment, higher psychopathology scores, and worse mental health status and treatment outcomes. However, although religious coping has been an increasing research focused on over the last years. Most studies have investigated the relationship of religious coping and depression. Only a few studies assess this parameter in association with anxiety, and this research has mostly been conducted with hospitalized somatically ill patients.
Okay, thank you so much. Yeah, so only a few studies also these parameters, occupation or anxieties, and this research had mostly been conducted in a hospitalist and somatically the patient. The somatic, last time we studied, right? Somatic therapy is not only the physical therapy, the spiritual, the mental, and emotion, and then movement. Also, we have a nutrition, so all covered, the holistic. So the somatic therapy and then mind medicine, the same value. So we didn't hear. One more thing here. Anxiety and anxiety disorder. Oh, okay. You have a textbook? You have one.
I don't know.
Okay. Joy, you don't have a textbook? Oh my God. You can.
We will buy. Basahin lang. Just
Joy,
for
come in
me.
here. Joy, come in here. Okay. Anxiety or disorder.
Anxiety and anxiety
55,
okay.
disorders. Anxiety is organizing basic human emotional constriction, fear, and inner restlessness that appears psychologically in unfamiliar or threatening situation and is always accompanied by physical stress reaction. The person and the specific triggering situation are important in determining levels of provoked anxiety. Great anxiety reflects a stable tendency to respond with anxiety in anticipation of threatening situation. Those anxiety should be viewed as a dimensional construct where personality variable as well as concrete research both are replacing the increase of the level of state anxiety. Anxiety disorders are characterized by a longer lasting, psychologically intensified and unfounded emotion anxiety which pulses physical and mental function and leads to avoidance behavior. Anxiety disorders are often associated with an underlying physiological dysfunction and lead to clinically significant distress, becoming a major disability for the patient. Here, the anxiety response is not expectable or culturally sanctioned response to a stressor and does not primarily result from a social deviance or conflicts with the society.
Okay, thank you. So you guys understand the anxiety or anxiety disorder?
What's the
Yes, anxiety disorder. Yeah.
What's the cause of mental disorders? Like physical illnesses or
Anxiety,
Mental disorder.
mental disorder.
Is that
So
what's
yeah,
the-
mental disorder means you have mental problem. Yeah, out of control. So mental, we are expressing word. Maybe we are happy, right? Your standard or your emotion or mood or mentally very healthy, but disorder means it don't work. So you want maybe you want to sleep. You want to sleep, but you can sleep. Why? I have too much thought. Or some suddenly I'm hungry, so you can sleep, right? But only a couple of days okay. But some stress, but joy give me hurt my heart. I'm very unhappy. So couple of days I'm okay. But 1 month, 2 months, she hates me. She all the time late class, unhappy. Oh, I don't want to hurt. I don't want to see the pain. Some very contrary personal lifespan is the word, but sometimes over cross. Yeah, so I can control. So out of control my.
What's sir if you have epilepsy?
That's another problem. So can I try to answer her question?
Yeah, okay, yeah.
Okay. Mental disorder, it is related to many various causes like biological, genetic, psychological and chemistry imbalance of the brain. So it depends upon how you can cope up with any circumstances in your life, positive or negative. So there are also social factors. And but mostly in medical science, it is related with genetic or biological. And as the latest I think study, it is related already with the food that we intake also and social environment.
Yeah.
Yeah.
So, good answer. For example, I have a experience. I was nursing home. I care the cancer patient and the dementia patient. Dementia. The dementia means you understand dementia, right? Yeah, dementia patient. Some people very soft, little haven't wake the brain tissue, but some patient deeply, 100% the dementia, but have or actually just started with dementia people. So we see 3 group, dementia, 100% dementia patient, no stress. They don't know by self, eat or sleep, they don't know. They can decline your the personal lifespan. The second have sometimes it's normal, but sometimes dementia, the memory. So they have problem symptoms. They have memories long time ago, 40 years ago, 50 years ago. Is memory very clear, but present maybe 10 minutes, 5 minutes. After 5 minutes, they forgot. So sometimes the confused. Yeah, he don't know, they don't know. But the step will confuse. So now we talking together, right? Talking together. Okay, I think she's normal. But later, hi honey, you think I'm husband, your husband. But sometimes with the communication or dialogue, change it. Okay, blah 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 something, and then suddenly change it. But one more, the situation just starts dementia. So she wants more, but try to more explain that she know that the personal life, everything, the organizer or something. So we have 3 groups, but we basically your mental disorder. She very the professional the answer. Mental disorder here. Very simple answer. I can't out of control. I can control my problem, my issue. So mental disorder means we need some help, the professional, the counselor or medical medication. Okay, so very simple here. Okay, mental disorder. So out of control. So maybe the cell phone or remote control, you don't have a battery. You can touch. You can approach the no screen, right? So the battery inside here you can control by self, but we are not mental disorder. Just stressful and just anxiety and just depression is baseline. So we not talk the mental disorder. Mental disorder very chronic, now acute, maybe 3 months or 6 months over, you can control by self. You try everything, right? I want to try listening music. I want to try food intake, or sometimes I want to try to some face-to-face or counseling, but it's not work. So we need some people. So more they basically deadline the first line is mental disorder. Okay. So Joy, you happy, right?
Yes.
Every day happy, 24 hours happy. You're mental disorder. How about you? You happy? Sometimes depression, sometimes happy, right? Yes, no?
Yes.
Yeah, it's normal. How about you?
It depends upon the situation. So if there should be if the situation is if we should be happy, then we have to be happy. But it will become a disorder if all are happy but you are sad,
Okay.
then the opposite,
Yeah.
reaction of
Yeah,
any
you are a
situation.
normal person. How about minister?
If the situation makes you happy, then you should be happy also. But
Okay.
if the situation makes you sad, and then you go with the flow.
Okay. Now only only the joy is staying power happy.
Always
So
laughing.
Always happy.
it's a mental.
Even World War III, he is still happy.
Yeah. So that's why it's a mental disorder.
Even your English is smile.
Yeah. So I have to give it to her the bitter medal. Bitter, more stressful,
He's
right?
still smiling.
Yeah. It's a mental disorder. You're a normal person. Okay.
Patay ka, Joy.
Okay, others and other personal belief, the such as the paranormal and magical meditation have been repeatedly or suggest important factors in the expression or cause of psychotic disorder and carving in the psychotic disorder, debut empirical evidence, the still scale. I warranted future research finding on the relation or RS, paranormal belief, and medical addiction to anxiety and OCD, represented below. Okay, 선생님, please reading the degrees for spiritual and anxiety. In comparison,
In comparison to other psychiatric disorders, there are only a few explanatory studies investigating the specific relation between religiosity and spirituality and anxiety. Hereby, two main theories become apparent. The first one promotes the Freudian hypothesis that anxiety can arise through negative religious conflicts, and that there is a positive relation between religiosity, spirituality, and anxiety symptoms. There are only a few studies that support this hypothesis, while most of them indicate a specific positive correlation only between anxiety and intrinsic religiosity. Two studies also support a positive relationship only between negative religious coping and anxiety symptoms.
okay, thank you. So you guys, you understand?
Yeah.
So
Yes.
the personal belief and the conduct or the anxiety or depression, right?
Religiosity and spirituality and anxiety.
Okay.
They compare the three things.
Okay. What is the three things summary?
근데 really 못하겠어요.
Okay. Yeah. Yeah. Point-able relation between illness and anxiety symptoms. There are only the few study that support this hypothesis. While most of them indicate a specific positive correlation only between the anxiety and extrinsic neuropathy, the two studies also support a positive relationship only between negative religious coping and anxiety symptoms. Okay, Minister?
Sure.
Yeah, the first second, please. You have a textbook, right?
Yeah, this is what I noticed with my book, sir. See? It's only until 25, number 25. The rest is empty.
No,
See? It's the same.
no, it's not different.
Is it the same?
Yeah. Oh my God. No.
What's your book? Oh,
Okay, I give it to you, choose one.
They give this to me. It's not. It should be. I should return this.
Yeah, so maybe talk to the people, okay?
Yeah. Okay.
The
That's why.
textbook, everybody is saying, yeah. Okay. The second, there is suggest neurist or negatively associated or anxiety and then purpose, the important word stress. The didn't lower distress, even the better outcome in the treatment of anxiety disorder. Results associating positive regrets having the strategy, the particularly regular church attendance. Yeah, so regular church attendance and either higher time every day, much better, and lower anxiety score have been often the depleted, whereas other studies report result over low anxiety levels among the more decreasing the sample over both healthy and then medically ill subjects. So the stress level and anxiety level, celebration level. So last week I want to test you guys. I gave you the questionnaire. So how's your lifespan? You are unhappy or depressed? Or what kind of mood? I found out a textbook. The last week, I went to the old bookstore. So I buy 34 kind of book. I buy $100. Yeah, for the personal life and then English or the counseling. So I found out the good research and evidence over the questionnaire. So I give you the copy for you. So you print me a little bit the homework, okay? Maybe you not print me, no score. So this questionnaire, the personal, individual personal life and the English or spiritual, the counseling, the questionnaire. So 20 kind of questionnaire. Joy, not yet. I have 1 hour more.
Kasi ikutin mo yung gilid. Yung gilid lang.
Okay. The laboratories, many studies failed to find a or scientific correlation between anxiety or individually the Becker and then Gross suggest to people that they try to more evidence the positive correlation or extra science or negative correlation over intuition to treat anxiety. Accordingly, the preparation over strategies to oriented, but as the instruct orient, actually and instruct. So in out, the subject word study could possibly affect the result. The diversity was spirituality and OCD. Okay. Yeah, one more time. In contrast,
In contrast to the other anxiety disorders, the specific relation of religiosity and spirituality and OCD has been investigated more thoroughly in the literature, as religiosity and spirituality has been considered to play some role in the etiopathogenesis of this disorder. The hypothesis of OCD as being to some extent an ecclesiogenic neurosis was postulated early in the literature. Higgins et al. And others found that indeed the percentage of patients with reported religious conflicts was significantly higher in the OCD group than in other anxiety and non-anxiety control subjects.
Okay,
Many researchers have come to the conclusion that there is a relation between religiosity and spirituality and some OCD traits. Especially higher religiosity has been repeatedly found to be positively correlated with subclinical OCD symptoms and cognitions, beliefs about overimportance of thoughts, intolerance for uncertainty, misinterpretation of the significance of thoughts, control of thoughts, perfectionism and responsibility, 81 poorer insight, and more perceptual distortions. Higher religiosity has also been found to correlate positively with the presence of religious themes in obsessive thoughts and compulsive rituals, even across different religions. In addition, patients with religious obsessions and compulsions also display significantly higher religious
The score, the religious score.
Scores than patients without these kinds of obsessions. Such results make the conclusion that OCD may be fostered by higher religiosity. Example, by the overzealous wish for spiritual purity, very tempting. Interestingly, there is an overall high percentage of OCD patients with religious obsessions. Many authors found that the possibility of a diagnosis of OCD by a clinician is higher when patient describes himself as religiously active, suggesting tautological interferences in some cases.
Thank you so much. The two person, the many researchers have the conclusion or the relation between LS or OCD. So they have more higher degrees have been found correlated positively or in present over degrees of 10 observed thought and comparison with the literature, even across different degrees. So we have Christian, but we have the other degrees people, the same issue. So because this is evidence of scientific or psychology, so only the Christian, no, we have even the other degrees too. So in addition, the patient, reversal, omission, or comparison or the display some sort of higher degrees of score than patient without the kind of obsession. Yeah, this kind of such leaders make a conclusion the OCD may be posed by higher degree, example by the over jealous or the positive, the very tempting, yeah, very important here. And also patient discover himself degrees of active, suggesting to record in influence or some case. Okay. Hello. Wake up. Wake up.
So I have a question.
Yes.
I have a concern with regards to this study. I mean, like, is it a paradoxical opinion? I mean, like, for example, this OCD case,
Yes.
it claims here that they are serving God or they're believing with God.
Yes.
Then, in contradiction to this study, they are more prone to OCD.
Yes.
So how is that said? Where is the belief now to the
Okay.
God?
Is that we personal 51. You guys enough your pray, enough mental the God the evidence of our life. So we stay here, right? The OCD. Sometimes this issue to apply. We want to try to more the church, the culture. Sometimes it's a more the historical the problem. Some of the Christian church very strict. So some people, some church, they allow some the outside of psychology or surgical and some evidence over some the mind medicine. So some of the church they're strict. They don't want only focus on the church. So this issue, maybe let's we still more. Yeah, some kind of the challenging. Yeah, it's not easy. So now,
there is an spiritual shock culture.
yes, yeah.
Okay.
So let's read some more OCD and we are the community care or the church is more you understand more. So easy explain. But now we start today with the history of OCD and then correct for some the mental disorder. So maybe next week is more we have more easy explain to you. Okay? We have a story. So I want to give the homework. Maybe next week you prepare reading is more understand. So this part is very difficult than the 1 week to the 4 week. Yeah. So
How about those?
the paranormal belief, anxiety, and OCD. The role of paranormal belief, OCD, and other anxiety disorder has hardly been investigated. The few available study results simply anticipated with some study suggesting or association between belief, the paranormal and lower anxiety or neuroticism, and others reporting to scientific or even negative correction. So anxiety, okay, anxiety, depression, okay, anxiety more negative or depression negative. Anxiety more positive or depression negative. How about things, minister? Only the depression only have negative, anxiety only positive. Anxiety is siding, right?
Anxiety.
Yeah, the depression, the minus,
Anxiety
right?
and depression.
Yeah,
What's the difference, sir?
yeah,
I think anxiety is your worry about the future, and depression is your
Upset.
upset and because of the problems at present
oh, okay.
or the
You think
past.
same thing?
Di ba, te?
How your
Anxiety
opinion?
ka ng kulbaan ka sa moabot.
Anxiety, like you experience
Maka-explicit. Di tataan.
experience something.
Tapos is
And then,
Ay,
The
experience ka niya.
depression, anxiety is like
Di ba,
you
di ba?
experience
Yeah,
something
anxiety.
and
Hindi,
you
wala na,
cannot
no?
do anything.
Okay.
And then the depression is like
Anxiety
you're
was
depressed
OCD.
because it
Parang sa
happened.
mental din yun.
Okay.
It's
So,
OCD.
Joy is a anxiety person or depression person?
Nothing.
Nothing?
No problem.
No problem.
You don't understand that
Okay.
because you
Anxiety and
don't experience,
depression.
you don't experience that.
What is the difference?
Pusi, digin pa rin.
Anxiety and
Obsessive
depression.
compulsive. Obsessive compulsive.
Pusi.
Obsessive. Obsessive kasi isang bagay.
Di ba yan?
What is anxiety?
Si Alfie, di ba yung message niya?
Pero hindi naman masyadong Pilipino natin, di ba?
Oo, message niya.
Kana nga mga anxiety.
I think,
Wala-
sir,
wala kay-
in
nakakapili
Philippines-
kayo daghan.
Yeah.
In
Filipino
Philippines, we don't
wala
talk
kay-
about like that.
kahit gawin
Eh,
Oh, really?
Here
Sa
in
Amerika,
America,
nakakana.
we go to the hospital or to the clinic.
Okay. Okay. It's anxiety. Yeah. So we party here.
May
Low scientific or even the negative correlation. Anxiety. Sometimes more dopamine, right? Dopamine, no dopamine.
Chemical.
Yeah,
Brain.
dopamine.
Yeah.
And adrenaline, cortisol. Okay.
Adrenaline, cortisol.
Yeah, cortisol. Yeah. So we have two hormone, and we have a symptom of our mental disorder, anxiety or depression.
So meaning to say, sir,
Yeah.
there is a chemical imbalance in the brain of
Yes.
that individual who has an anxiety.
Okay. So we study CBT, connected to the CBT, LNP too. I study LNP. So later we have brain tissue, but we have a second brain, the gut. God has. Sometimes the God has uncomfortable. Yeah, unhappy. We have mood is unhappy.
So that's why sometimes they have this gastric ulcer.
Yes. Yeah.
Yeah.
So-
Emotional ulcer.
Yes. Emotionally or indigestion, we have the cheese is not true. So sometimes we have the stay here, isolation here, no circulation here.
Mhm.
The gut have problem, so we see. So, for example, I'm hungry.
Mm.
Okay, I'm hungry. So I'm hungry. So brain think about I'm hungry or gut think I'm hungry. But think where? The gut think about I'm hungry. I need something. The food intake or brain. I'm hungry. I have to eat something to take a food. Other things. The gut first or second? First or
First.
second?
The second.
How about you? First
Hungry.
or second or first? The second.
First, second.
Second. Wilson, how about you? You're hungry. You're hungry. So you think about you have a sense to
In your stomach.
the brain first or second gut or gut first the second. Minister,
Sir,
what you answer? The first or second or first second?
Gugutom ka daw yan. Ang mga
Tiyan mo or
magsabi.
ulo mo.
Diyan mo yung ulo mo.
of course, the brain.
Brain?
Because everything starts from the brain,
No,
sir.
I'm stomach.
Joy, how about you?
Stomach. And then the
The
brain,
gut?
the brain tell that you're...
Okay, how about you? Your opinion. First or second?
Kaya salita mo siya.
First? First or second? Second or first or second?
First is
Second.
stomach.
Yeah, you are right. The first.
Yeah, first, tama.
Oh.
Yeah, first
tama.
and the second.
Brain.
But it's not the joy, both.
Lagot.
Yeah, so second brain.
Kasi
Yeah, second brain. So we have a serotonin. You know that, right? The hormone, serotonin. You know dopamine, oxytocin, the serotonin, right? Yeah, serotonin is a happy hormone, right? So happy hormone, the serotonin have 70% be produced in here. So you are uncomfortable, maybe for example, competition or sometimes the idea, you're unhappy, uncomfortable here. So we are some the stress. Yeah, sometimes depression, some. So we have the second brain. The second brain, so very important the brain first. Just second? No. The second brain means it's more influence our body. Okay, the serotonin hormone, the 70% inside here, the small instant they make the hormone. The brain is stupid sometimes. Okay, for example, we have lemon, right? I will grab one lemon. How's taste lemon?
Sour.
Sour, right? Okay. Imaging therapy, you close eye, I give you chocolate. Cross eye, Joy, cross eye. I give you chocolate.
Yummy.
What 30 seconds. So try. I give you grab your hand with a chocolate. How do you feel? Taste?
Sweet.
Sweet. Now I give it to you one grab of a lemon. You have to eat chewing everything. How about yourself? Taste? Sour.
Another
Yeah.
one?
How about the sours coming out, right? The sweet and then sour, they come more, several more out. So the brain sometimes very smart. Sometimes the crazy. The mean, so we study imaging therapy or positive or psychology coaching. Our body depends on our brain inside what kind of things, positive or the negative thing. So depend, and then the results, our body tight, sometimes very soft movement. So mean the happy, if you want to happy that your life, I'm happy person, I'm very happy person, and our body feel I'm very happy person. But sometimes I'm the depression people, I am failure, I'm the not good my life. I have a depression, our body have depression. Okay? So brain, don't believe your brain. You have to believe the second brain in God. So you have to try to reset your mind, the brain. I'm very happy person. You think I'm very happy person. And the spiritually and then the mental. Okay? Joy, I know you are 24-hour happy person, right? Yes. So you're a happy person, your life more happy. I'm very depression patient. You see our view, everything is my suffering time. It's not unhappy, right? To our knowledge, the only study directly investigating and comparing difference was paranormal belief between healthy subjects. In the paranormal, the belief between healthy subject, the patient with anxiety disorder and the patient with OCD was conducted by a research group. The found were differences were paranormal between OCD patient and anxiety patient and healthy control. No difference between healthy and non-healthy subject, and also no difference among the virus or anxiety subgroup. So we have two groups, A group, B group. So we compare between the paranormal belief and the healthy subject, patient with anxiety disorder, the patient with OCD. This one is conducted by our research group. No difference in the paranormal belief in the OCD patient. Yes, they say. For anxiety patient and health control, no difference between health, non-health subject. Also, no difference among the virus or anxiety subgroup. So we have sometimes we have a blinded trial. Sometimes we have to compare anxiety or OCD and depression OCD patient, the similar. So we have to very different to compare. Sometimes we have to integrate. So this bilateral anxiety subgroup, such group, or just the research group, no difference. Okay. So we have to together mental disorder. We together we have to approach for something. So the Joy is a happy person. So I give more happy people give something. Is something mental disorder, right? But sometimes I give something I do more chill. Oh, okay. I want to more try to more activity with the pace more happy. So depression people have to stay in the isolation, the pace. We have the pace to pace. So we have to open door. We meet the people. So we have a solution. The mental disorder we can't solve by myself. We need some depend on community or some the plan, friendship. But over is a deeper is a mental disorder. We need a treatment, the professional, and we have medication. Okay. The medical education or anxiety OCD, the most exploratory studies investigating the specific relation over medic edition OCD have a report for possible correlation between medical edition score and OCD symptom in clinical and non-clinical population. The medical edition were generally being found to be positively related OCD complete or symptom and traumatic symptom. The frequently found OCD patient, such as literally the behaviors, post-traumatic dissociation or thought out action fusion 110. In addition, OCD patient score higher in the medical edition scale than your healthy control or patient with other anxiety disorder. And medical edition have been shown to predict negative outcome in the OCD patient. Interestingly, the patient with neglect or omission and confusion also display sensibly higher maker the edition score than the patient without this kind of omission. So let's say I use some questionnaire, the mental the disorder, the medical edition, and then we have the solution over anxiety and then depression. Okay, maybe 20 kind with the questionnaire. So we have to submit. Okay, the homework. Yes. You have a question? Yes, so homework. Yes. Let's say I give you copy for that, and then the other week the subject. Yeah, you can study at home. The relation between the medical edition and the other anxiety disorders, on the other hand, has barely been investigated. There are only 2 studies found in our literature. In the first one, the medical edition the score did not differ the sensitivity between OCD and generalized anxiety disorder. While the OCD group showed scientifically higher score than the healthy sample. So here the two samples here. We have 2 studies. In the second studies, the panic disorder. What is panic? Joy, what is panic? Yes.
Panic.
Panic.
What is panic?
Panic. Is ano problem?
Action lang siya, action.
With that panic.
You never
You don't know what
experience.
to do.
You never
You don't
experience.
know what to do.
How about you? You have experienced panic?
You panic sometimes. You will be panic because you don't have discipline. So
Okay.
you cannot do, and then you have to do it.
Okay.
Because it
Oh.
is not
No
like
decision.
that. So
No choice to decision,
don't
right?
panic. I'm panic.
I do panic.
Okay.
Sometimes I forget.
How about the panic? You have the experience of panic? Panic attack? Yeah, some.
Not really. 그러니까 패닉이라는 거가 이렇게 공황장애 같은 그런
Yes.
거죠?
Yeah.
근데 그렇게
Overwhelmed ka. Overwhelmed.
Okay. Some expected situation, some out of mind. So last time we see the mental disorder, right? I can control something out of mind. So I don't know realize the situation. How can I do? Even the how can I do? I can. And shock. Yeah, shock. Means a panic. I can think about anything. And feelings go. Feelings out. What is panic? Panic.
Panic.
Yes.
Panic dati, panic.
Panic. That's right.
Panic.
Panic.
Yes.
It's an overreaction of an individual to a certain situation. So, for example, there is fire, then there's a panic of people. So it is an instinct reaction. I mean, voluntary reaction of an individual.
Yeah. So means the simplest out of mind. Some really panic, the shock, you can really see, right? Even though you prompt here, you can recognize anything. How can I do? I can. Only feeling out. The only shock, the panic. Yeah. The mental disorder is different. The more deeply the disorder. So the panic, yeah, very deeply. The panic disorder patient report scientifically the low medic edition score compared to OCD patient, the different graphic. One for the panic disorder patient were found to score similarly healthy control group. Our recent study showed that no scientific difference in medical addiction treated between OCD patient, the patient with other anxiety disorder, and healthy control. We additionally suggest that difference or for OCD specific item in the original medical addiction scale, the questionnaire might result the higher medical addiction, the score in OCD patient as seen in other study. So the questionnaire, the original medical addition the scale of the questionnaire might be result higher medical addition score in OCD patient as seen in other study. So last week I give some questionnaire. So frankly you have to write down you by yourself. So maybe you give to me, I will give a personal result and then coaching for you. Okay? They are very simple. It's not hard. But usually outside. You have to pay $100 by free, okay? Little coaching for your tip. The counseling, it is our referral principle. The counseling, it is. So we had coaching, we did some coaching or counseling or research or medical treatment or the psychological counseling. We had to study counseling, it is the referral principle. The counseling, it is in the referral principle, essential for maintaining integrity or trust in the counseling profession. The trust. So, I want to help her. I want to help him. We either dialogue or communication and medical history or personal life and everything. Truly, we need to trust. And we have to secret, we have to keep. We not open the other public people. Maybe we open the public people, the SOPA rules, destroy, and then we broke the trust. Oh, okay, I can no more tell. Because you tell somebody, then they show me my situation, so we can the treatment. So with the addicts, we have to more keep the secret, okay, the personal privacy. The referral principle is essential for maintaining the truth within the counseling profession. The principle guide counselors in their professional conduct, ensuring that they act in the best interest of our client and then on whole welfare of our society. The key ethical principles include autonomy, respect for client right, make their own decision and act over their value. Their own decision and act over their value, very important here. And non-malpractice, avoiding harm to client and ensuring that their right and then dignity were respect. So don't push. So only depend on your customer, client, or decision and belief too. The benefits, the promoting their arriving or client and taking the responsibility for their care. Justice, the providing repair and then equitable treatment to all clients, regardless of their circumstances. Plurality, honoring all professional community and maintaining the truth between the counselor and the client. The liberal principle also critical the counseling as they ensure that the client will report operative service and resource when research. The principle help counselor negative complex situation, the manage all relationship and maintain professional integrity. Continuous education and the supervision of beta over counselor to especially negative navigate related dilemmas and on hold highest the standard of ethical practice. The counseling is and the liberal principle from the foundation of effective counseling practice. They guide the counselor in maintaining professional integrity, protecting client welfare, and fostering the truth within the therapeutic relationship. The client and the counselor. The autonomy is referred to respecting the client's right, no counselor right, to make their own the decision based on their value and belief. So we study personal value and then belief. So counselor support client by providing information and guideline without imposing personal opinion or controlling outcome. So we have to very important here. Counselor support client providing information and the guideline without imposing. Maybe this kind of person, maybe this too. So imposing personal opinion or controlling outcome. Gaslighting. Joy, you know gaslighting, right? What is gaslighting? Okay. This what is that? Mouse, right? Okay, Joy. This is apple. What is that? Okay, it's good. Gaslighting. Maybe. Okay, what is that? Okay, what is that?
Mouse.
Mister, what is that?
It's mouse, but what do you mean, sir, about
Like a mouse, right? What is that?
Yeah, mouse.
Okay. We are 1, 2, 3, 4, 5 people. It's a mouse.
Mhm.
Joy, is it apple or mouse?
Mouse.
No, you say the apple. Okay. you say apple. Okay. What is that?
Yung sinabi mo kanina.
Apple?
Apple.
Uh,
Apple. Okay. Really is apple. This one. Apple. But 5 people. What is that?
Mouse.
Mouse. We are mouse, right? But Joy said apple. The originally is apple, right? But we see 5 people. This is mouse. No apple. Joy.
No, everything computer. Joy, everything.
Sige lang, example lang.
Yeah.
It's just an example. It's just an example.
Okay, I understand. He's a mental disorder. Okay. So impact. Okay, without impacting the personal opinion, the controlling outcome, the gaslighting. So, Joy, what is that? Apple. We are mouse, right? So, Joy say, complain. Dr. Joy is stupid. This is apple. So you talk to me, it's apple. What the apple? No. It's a mouse. The only choice, apple. Our opinion is mouse. So maybe how about the decision? There are people other, so I want to go outside, right? Okay, you can go. So she can join the community. Okay, I'm this apple, but everybody knows this is a mouse. Maybe she wants to stay here. Maybe 12 o'clock, I give lunch, the Joy. But Joy, okay, the doctor, the Joy, okay, what is that? This is a mouse, apple. So maybe mouse, maybe people stay here, I give steak. The apple, I give just taco. Okay, Joy wants steak. What is that? Mouse, right? You before your apple, right? Now mouse. Why? I want to eat the steak, right? So small opinion. Sometimes we have big opinion. Sometimes depending on is my situation, from mind or sickness, we have to do observation here. So thus enforcing the personal opinion or control the outcome. The gaslighting, for example, the gaslighting. So we give some the misunderstood, something the misgive the evidence. You understand? So sometimes A group, B group, A small group, B group, big group here, the community. So sometimes we want more relationship, but sometimes we have the same level. This group is mouse, but this group, small group, the personal opinion is apple. So B group did not come in your group. A group moved to B group. Why?
Set. So
Yeah.
meaning, in the side of the counselors, so there's a little bit of compromising.
Okay. Yes.
So in order for the patient to be at least recognized, I mean like compromising means just to accept their opinion
Yes.
in order for them to be healed or
Yes.
help
Yes.
their behavioral disorder.
Yeah.
So there is
So-
compromising.
Yeah. So the the personal opinion or control outcome. This is a counselor side. Okay. So sometimes because we have to study the counseling ethic, so do not this two kind.
Do not contradict.
Yeah, because we have to depend on the client or church member opinion, respect them, and they give to me information, and then we have counseling depend on your customer information. Okay, but maybe you see, just important person, okay, this kind of person, okay, maybe I think this kind of person, this kind of person. So we not listen no more the customer. I already figure out this kind of person, this do, and control the outcome. Okay, Joy. I thought it's apple. No. Okay, Joy. Okay, this is a mouse. Okay, what is that? Apple. No. It's a mouse. So we have to control its outcome, right? The gaslighting. So we have to give some the press. Maybe okay, she's ugly. Okay, you're a good person. But sometimes you're not upset. I'm the temper or maybe controlling tribe. So we have to two kind. Yeah, the way the counseling the edit, the very important here. Normal reference means avoiding harm to client. The counselor must act within their scope of competence, remain aware of potential risk. The potential risk means unexpected situation, but remain aware of potential risk and ensure that the action do not cause physical, emotional, or psychological harm. So we have to avoid this situation, unexpected situation. The benefits involve activity promoting the well-being of clients, counselors, the stable plant grow here and assess appropriate client support while prioritizing client best interest. The justice comprise or parents equality counseling. All clients should receive equal quality of care. The justice, the pair, regardless of our background or identity or circumstances. The parity report to maintain interest, harnessing the professional commitment and unholding compatibility. The counselor must establish clear boundaries and remain deliberate and honest in their professional relationship. The referral principle ensure that the client receives appropriate care when their needs fall outside the counselor expertise or scope of practice. Ethical referrals protect client and support continuity of care rather than the single professional culture, ongoing education and then supervision of countries education and professional supervision essential for ethical counseling practice. They help counselors remain informed, address ethical development, and maintain a high standard of care. So we have back there the first, the Christian Counselor Conference, maybe long time ago. So if you have a chance, you try to research this kind of conference. But every year I joined the Mind Medicine Harvard Medical Society and the Christian Counselor Conference. So you have a teacher and then you try to the information, the society. They give a lot over the counseling over the Christian, their evidence or scientific or the professional information. They have a lot of the list. So you can try, and then also you have a Christian volunteer and the church, so maybe more useful take the information. Okay. So today we study the boundary between spiritual issue and then mental disorder, anxiety or depression. Also we did mention that the hormone, the happy hormone is dopamine, oxytocin, and then some serotonin, and there are the stress hormone, the adrenaline hormone, and the stress hormone, the cortisol hormone. So last week we tried a little more detailed OCD, very simply giving information, and yeah, please lead it to 6 weeks next week. Relational conflict and the spiritual affair. So this textbook, Christian spiritual affair. So affair mean word, right? The relation to relation, the face to face. So last week we have overcome the mental disorder and then personally believe they continue. We starting the spiritual affair, the focus. So what is the spiritual affair? I recommend the book, the spiritual warfare, maybe to pick the best bookstore. I want to try to some copy, some the Korean language, but I want to translate it in English. I copy for you. The spiritual affairs, the more very important our life, the spam, and then the Christian culture inside. Okay, so
We have to buy sell.
no.
No, okay.
I copy some for you.
Okay.
Yeah, I translated the little copy for you, and then I give one questionnaire, the personal belief, and then the Christian counseling. Okay. So if you have time, please need to prepare the class for next week. Okay. And then if you need more question or something, ask me. So next week we have more the communication easy. Okay.